Toth. I'm the Care Services Coordinator for the ALS Association Evergreen chapter, and I cover all of Central Washington and Eastern Montana. And I am thankful that Kate Buffington could join us today and talk a little bit about advanced directives and living wills and what the difference is, because I do get a lot of patients that come to support group or are at clinic wanting to know when they can fill it out, who can fill it out for them, and all of that goes along with that. So I thought it'd be a great topic to discuss, and you could share with us. And Kate is also from the Kadlec Regional Medical Center down in Richland. So thank you for joining us, Kate.
You're welcome. So I thought I would just start off with sharing some definitions regarding advanced directives and all these terms that we hear. So this is just kind of an overall slide, or overall, there's lots of terms out there, right, with advanced care planning. We hear advanced care planning, we hear advanced directives, we hear living wills, we hear the durable power of attorney for healthcares or proxies or healthcare decision makers. I mean, there's healthcare agents, there's a ton of terms out there. And so advanced care planning is kind of an umbrella term that really is all about those future healthcare decisions, that the conversations around that. And then completing those documents and then making sure our people understand what we want so they can honor our wishes. So then we have our advanced directive, which is the document, that written document that prepares people so they know what you want. It identifies those trusted decision makers, those people we trust to make those decisions for us. Mm-hmm. And then it explains and tells those people and anyone reading the form what we would want, right? What kind of care would we want if we were unable to make our own decisions? And it really takes effect only when we are unable to make our own decisions. So whether it's a car accident, a sudden illness, or, with ALS, it gets to the point where you can't make your own decisions. This is where you have already had these conversations with the people you trust, and they know what you would want, and they would be able to honor what you would want. That durable power of attorney for healthcare, that's that trusted decision maker. That's the person that is legally appointed to make medical decisions for you when you're unable to make your own decisions. And then the living will is the guidance, these are the type of decisions I want made. This is the kind of quality of life that's important to me. So, I just like to go over all these different words that come along with all of this and just kind of give a nice, clear, I like this view too, like this picture too, because it gives a nice visual of everything.
Yeah, I would have to say with just the years working with ALS patients and their caregivers and family members that this is always a big topic. Mm-hmm. So this is great.
Awesome. So the other thing I was thought would be good to go over is the difference between an advanced directive and a POLST form. So that POLST form is that bright green form that you see on the screen there. It stands for Physician Order for Life-Sustaining Treatment. And so I'm just going to kind of go through the differences here, and then Lisa, if you have any questions to help clarify anything, let me know.
Perfect.
But an advanced directive really is for anyone 18 and over to fill out. And it's about those future healthcare decisions, right? This is if something were to happen in the foreseeable future, this is how I'd want care to go. The POLST form is for persons with serious illness at any age. And it provides medical orders, so those physician orders for current treatment. So if something happened in the foreseeable future, my doctor and I have agreed on this is the kind of care that I would want. And so it covers CPR, and it covers if you want full medical treatment, or you want comfort measures only, or somewhere in between, how you feel about artificial nutrition, hydration. It covers a bunch of those things. The one thing the POLST does not do is legally appoint someone to make those decisions for you. That's what the advanced directive does. The POLST does guide emergency personnel. So if you were at home and something happened and 911 was called, and emergency personnel cannot follow an advanced directive, they can only follow the POLST form. So for people who say, like, when I hit 90, 95 and I don't want CPR anymore, I don't want any of that, I'm going to have a POLST form, because otherwise if somebody calls 911, they're going to be doing CPR on me unless they have that POLST form. Both of them guide inpatient care. So both of them are followed in the hospital. Usually they'll go to the advanced directive to see who to call, to see who those trusted decision makers are, so that those people can make the call. But if anything, they have more information than not having one on file. Does that make sense?
That makes sense. What would your recommendation be for folks to keep and put their POLST if they're in their home?
So EMS is trained to look for it posted, like, on the fridge or by the front door, somewhere where it's quite obvious and can be seen. And then the hospitals can have a copy on file. So, if you, depending on where you live, you're going to want to make sure your closest hospital and your preferred hospital, because those can be different sometimes, have something on file. And anywhere you do medical care, make sure that they have a copy on file, so that depending on what your wishes are with the POLST or the advanced directive, with the advanced directive, they know who to call. And with both of them, they know what kind of wishes you want, what kind of care you would want.
Okay. That's great.
Does that answer your question?
Absolutely.
Okay. All right. Let's see. I think the next thing I wanted to talk about is, why is this important? Besides the obvious that our wishes are known and we can have the care that we want, right? So, and it does ease the stress on our family members in hard times. So you've already had the conversations. They have a really good idea of what's important to you, what kind of quality of life is important to you, to help guide them and help making decisions for you. They don't have to guess. They don't have to come out the other end of it saying, did I do the right thing? Did I wait long enough? Is this what mom or dad would have really wanted? Those kinds of things. So it eases that stress. There's been studies too where they have looked at families that have gone through advanced care planning and families that haven't, and then they had like a traumatic thing happen and the person passed, and the families that had advanced care planning were reporting way less amounts of, like, post-traumatic stress disorder and the feelings of guilt and all those. Not saying that those are going to be there anyway, or that this makes it any easier to make any of those decisions, but knowing that this is what the person wanted helps a lot. It empowers you guys to talk about it, right? It brings it up. It helps sharing, focusing on our goals and values is one of the best way to really address this. We're not talking about how you want to die so much, we're talking about how you want to live. So pretty, this is an important reminder, is that you can change your mind at any time. So just because you signed on the dotted line, had it notarized, doesn't mean you can't go back and change your decision makers or say, I've changed my mind on some of these things. The first thing I want you to always do when you do change your mind about something is to have the conversation with those trusted people in your life, those decision makers that you've appointed, so that if you don't get a chance to go back and change the document, you've had the conversation. They know that this is what you want now. And I know we're really in like the big general population, we're really trying to make this a normal conversation, and we're really trying to make it as normal as getting your blood pressure checked. So, yeah.
Is there a time duration, Kate, for when you want to change it? Immediately once it's changed, they abide by it right away, or is there a time?
Yeah, so as soon as you have a new document, it supersedes the document before it.
Okay.
So as soon as that new document is a legal document, that's what you go by. But you have to get it on file at all the places, right?
Right.
Especially if you're changing decision makers and you don't want previous decision makers called. So they're going to go on the information they have in front of them. Does that answer your question?
Yes.
Okay. I thought it'd be important to touch on the role of that trusted decision maker. That, you know, healthcare agent, as you see on the screen, is another way to say it. But our power of attorney for healthcare, those people we legally appoint to make decisions for us. So it all comes down to who do we trust, and it all comes down to us being able to choose who we want to make those decisions. Because in Washington State, if you don't have anybody to make, if you don't legally appoint anyone to make your decisions for you, they're going to choose. The state is going to go down this hierarchy. And they're gonna, so right at the top is a guardian appointed to the state, which usually if you have one of those, you haven't been able to make your own decisions for a long time. Then is your healthcare agent, or that trusted decision maker that is in the Advanced Directive. So if you don't have one of those, which is what we're talking about today, the state is gonna automatically go to your spouse or partner, registered domestic partner, even if you're separated. Wow. So that could be motivation enough for somebody to get this done. Right. If there are no spouses, they're going to go to your adult children. Now, anytime there's a group of 2 people or more, they all have to agree. So it's a consensus, not a majority. So with those adult children, depending on how well they get along, you could see how this could get kind of messy, right?
Absolutely.
If there's no adult children, any living parents. If there's no living parents, it goes to your adult siblings, again, depending on family dynamics, you know. So and the list goes on and on. So to make this a lot easier and a lot cleaner, it's not a bad, it's a good idea to get this appointed, right?
Absolutely.
So, you know, for some people, you know, they don't want the state choosing who is going to make decisions for them. So here, you know, put the power in your hands and you get to choose. So when we're thinking.
That's great. I've never seen that. That's great.
Do you want me to email that to you? I can email that to you.
Yes, that would be wonderful. I can share that at support group.
Yeah, it kind of paints a good picture there.
It does.
So when we're thinking about those trusted decision makers, there's a few things that we want to make sure that they have. Some qualities. First of all, we want them to be legal age. We want them to be at least 18, and we want them to be willing to do this. We don't want them blindsided by a phone call and say, guess what you get to do? You know, that would not be cool. So we want to have conversations with the people we're thinking about and make sure that they're willing to do this. The next thing is we want someone who we are pretty confident can handle hard decisions, especially with a lot of emotional stress going on. So, for example, my brother, I don't put him on any of my documents because if I were in a situation where I would want like the plug pulled, he couldn't do it. He wouldn't be able to do it. So he is not the best person for that role, right?
Right.
So we want people we know that can follow through and that can hold themselves together enough to be able to do this for us. And it doesn't have to be family. I want to make that clear too. Okay. It doesn't have to be our oldest kid. It can be a trusted friend, a best friend. A best friend. It could be an aunt or an uncle, or I've had people choose their grandkids. And so, I mean, think outside the box. It doesn't have to be your spouse or your kids.
Okay.
We want someone who is going to honor your wishes, even if they don't agree with you. So that's kind of, again, like my brother's a good example of that, right? He wouldn't agree with pulling the plug, so I'm not gonna. I know that's a bad term. I'm sorry, but you know, I'm not going to choose him because he wouldn't be able to honor what I would want. You know, right. I know he loves me, and I know but I just wouldn't want to put him in that position to have to go against what he believes. We want people that we can talk to about this stuff, right? We don't want anyone where as soon as you bring up, you know, when we get close to death and then the wall goes up, there's no communication whatsoever. So, you know, making sure it's someone that you are pretty comfortable talking to about this stuff. And then we got to be able to reach them by phone, by email, you know, whatever communication you have, but they need to be reachable. It wouldn't be good to pick the son that has escaped to the Amazon, you know, for the last like 23 years or whatever. Like they wouldn't be the best choice, right?
Right.
All right. Okay. Let me see what I got next for you. You know, and then this last point is just kind of addressing when you change your mind. So, you know, that when we give somebody the legal authority to make decisions for us, they get final say. Which is, I think of that as a good thing. It means that if I do change my mind and I go to my husband and say, you know, I've been thinking about this, I really don't want this anymore, I would rather have this, and I don't get a chance to go back and change my document, then he knows. And he has that final say, and he gets to honor that wish, even though it's not in the written advance directive.
That's good. I like that.
Okay. Yeah, any questions so far?
No, that's great.
Okay.
Straightforward.
We doing good on time and stuff?
Oh, we're great.
Okay, just make sure. All right, so because I could talk about this all day, Lisa. All right, so you know, we could go through every kind of scenario where we would end up being unable to speak for ourselves. That would take forever. Those documents would be horrendously long. It's infinite the ways that would happen or could happen. And so what we encourage you to really think about is quality of life and kind of outcomes you're okay with and outcomes you're not okay with. So when we're preparing our decision makers, you know, we can paint this really nice picture for them that they can put into any scenario, and it will help guide them to make decisions. Let me see what's next here. So when you're thinking about that, thinking about quality of life and what's important to you, I want you to think about the things that make a good day. So when you're having a good day, what is it about that day that makes it good? Is it, you know, I have people say, well, I woke up, so that was good. And so, well, that's a start, right? But is it the fact that you're able to communicate? Is it the fact that you're able to go outside, that you're able to be around the people you love? You know, really kind of dig in and really kind of try to think about what are those things that make a day really important, that bring it up. Think about, you know, I know living with ALS that sometimes you're faced with things that you have to live without already. So, but thinking about parts that you still have or parts that would be, that kind of draw the line, like that would be really hard to live this way. Think about if something were to happen, what kind of outcomes would be okay for you and what kind of outcomes would be unacceptable to you. So I like to tell this little story to kind of think about that. And so there's a book called Being Mortal. I don't know if have you read that, Lisa?
No.
It's by Atul Gawande. I probably have a copy around here, so I'll let you borrow it.
Okay.
And he talks a lot about end of life in this book and how our society, American culture, doesn't like to talk about it very much. And so he's exploring that and talking a lot about advanced care planning. And so in this book, there's a story about a father and daughter who are going through this process, and they, you know, they're talking about quality of life, and they're like, Dad, what's important to you? What makes a good day? What makes life worth living? And, you know, he was kind of able to get down to a bare minimum, kind of a baseline quality of life. So for him, if something were to happen, he would still find some kind of quality in life if he could still eat ice cream and he could still sit up and enjoy his football games. So for him, anything less than that as an outcome not okay, not acceptable. And so this helped guide the daughter a little later on about, she had to make a decision about a surgery for him. And so she was able to take that to the doctor and say, hey, if he makes it through the surgery, what's the likelihood that he's going to be able to eat ice cream and he's going to be able to sit up and enjoy those football games? Because I know I'm going to be in big trouble if he can't. If he gets through this, he can't do that. So that helped guide her, right? It helped guide her in making a decision, which is what we're trying to do for our decision makers, our trusted people. And so if we can kind of paint these pictures and think about, you know, that bare minimum, and think about where that quality of life that's really important to you, that helps guide people in making those decisions. So.
And these really talk to just about, not just folks with ALS, but just us in general, what our bottom line would be and what we, so no, this is great to,
yeah. So, so then when you're kind of thinking about the type of care you would want if something were to happen, think about what would happen if you came through it, and what would be okay and what wouldn't be okay. You know, the big what if questions, that what if something were to happen, just something, you know, let's see, I'm gonna click through this. So this is just part of the advanced directive that I provide when I consult with people when we do our advanced care planning conversations. Okay. So we talk to them about, you know, if there was a sudden illness or injury, or you might be so sick you might die soon, how do we best provide care for you in that scenario? So I like to think of it as you're incapacitated. We don't know why. Could have been a car accident. Could have been something totally weird and out of left field. Who knows? But what we need to know is what you'd want to have happen next. And so whether that is, you know, trial life support treatments, you know, and stay on those machines that prolong your life even if you're suffering. Trial life support treatments, but you know, that doctors recommend, but if they don't work, if the treatments aren't working and there's little hope you're going to get better, you know, you want them to stop and to be allowed to focus on your comfort and die gently. You know, whether you don't want life support treatments, that you want to just focus on your comfort and your natural death. When it's your time, it's your time. And some people want their healthcare representative, that trusted decision maker, to decide for them. So yeah, so that's just something to think about. Like that's how it's presented in the documents that we use. There's lots of documents out there. There's like 5 wishes, and I mean, just if you go online, you can find a ton. But we use the one that Providence has come up with through the Institute of Human Caring, and it's a pretty good one. It's also based off of one. There's a thing out there called Prepare, and it's similar to that version of it that kind of walks you through the same thing.
We're familiar with the 5 wishes too. We have that.
Yeah, it's a good one. So when you get your documents and you have it all done, you want to make sure that the hospitals, we kind of mentioned this already, that the hospitals that you would go to and the healthcare places you would go to have them. You would want to make sure that your people that you name, that you legally appoint as those trusted decision makers, have a copy so that they can refer back to it. And, you know, I say give it to anyone who's important in your life that is part of that conversation, so they hear it from you and what you want, and not from sister in a high stress situation, right? Like, right. So, you know, I think having these conversations out with broader than just the people in the document is important, because then they can come and support, right? Those people can come and support and say, no, that's what mom wanted. Don't you remember when we all talked about this? Right. Over whatever, Thanksgiving dinner or something. All right. So yeah, that's what I just said. You know, always have a copy available to like take with you, just like the POLST form. You want to make sure you have a copy that is, because if you have to rush off somewhere different, somewhere new, that way you have a copy to take with you. And usually places can scan it and give it back. But I'm not going to speak for most places either.
Cadillac's great about that, though.
Yeah.
Yeah.
So, let's see. Yeah, and if you have to go to a new hospital or a new care facility, make sure that you have, so that they know who to call, and they're going to be able to make decisions based off what you want and not guessing, or not off what they have to do.
Right.
I like to go over this too, just the when to update, when to go over it, when to review the document. So, you know, every decade, whether that's 2020 or your personal decade, you know, when you hit those milestones, it's a good time to review it.
Yeah.
You know, if you have a death of a loved one, it's a good time to look over it, because maybe you have to change one of those decision makers, or maybe, you know, something about that experience has changed your mind on a few things. Anytime there's that divorce or major family change, because again, that might affect who you have chosen. Anytime, you know, the diagnosis is, or major life changes in health, or any decline in health, it's always a good time to review and make sure that, you know, especially living with ALS, having those discussions with the providers and the doctors about what things might look like to help inform your decisions and what you want. And anytime you move, like out of state, it's a good, or, you know, if you're lucky enough to snowbird somewhere or whatever it is, you know, it's a good thing to review it.
Okay.
So again, my big thing is conversations, talking about it. Even if you don't get to the point where you fill any of this out, please have the conversation, especially with the people that would be hitting the top of that hierarchy, right? So they know, so they can come in and not be guessing what you want. And then they can find out, like, they might have some weird questions to ask you about what you mean by things. Maybe not weird questions, but just regular questions.
Just to clarify, yeah.
Just to clarify, right? And because when somebody says, you know, I don't want to be a burden to you, well, when I say I don't want to be a burden, I picture something different. Or if my mom says she doesn't want to be a burden to me, I don't picture her taking care of her as a burden, but she sees it as a burden. So we got to figure out what that really means, right?
That's a great point. That's a great point. Yeah.
So those kind of vague umbrella words, we really got to kind of break those down and really think about them, and get more specific. Yeah. So just making your wishes known to those who will be there, so that they know what you'd want, and they're confident that they're making the best informed decision for you with what they know at the time, right? With whatever circumstance that's in. Yeah, there's my contact information.
Perfect. And Kate is part of the ALS Clinic in Richland as well. She's my counterpart there.
We're teammates.
Yeah, we're teammates. Oh, Kate, that was wonderful.